I'm Caesar, so I'm going to be demonstrating how to measure blood pressure today. So before we get started, I'm going to give you a quick overview of the equipment. So we have here a blood pressure cuff. Collectively, it's called a sphygmomanometer. The parts of the sphygmomanometer are going to be the bladder, which is the plastic part you can sort of feel in beneath here. And then you have the dial, which gives you a measurement in millimeters of mercury. You have the cuff. No, I'm sorry, this is the cuff, and then you have the pump. And so before you get started, you want to let the patient know that they want to refrain from any kind of exercise, nicotine, or caffeine 30 minutes prior to the test. So one of the other pieces of equipment that we use is the stethoscope. You have the dial to the stethoscope, and then you have the earbuds. When you place the earbuds of the stethoscope on, you want them to face forward or away from you. All right, so now I'm going to show you an example of how to take blood pressure on a patient. So prior to you actually performing the activity, you want the patient to be sitting for a minimum of 5 minutes, and you want his back to be supported, you want the feet flat on the floor, and then you want the arm that you're going to be measuring to be rested. So before you put the cuff on, the blood pressure cuff actually gives you a couple measurements that indicate the size. So this one right here would indicate select the larger cuff, and then you have another line that gives you a smaller cuff. And then on the bladder area of the cuff, it gives you a side to place against the limb and the artery mark. So we're going to be placing the artery mark on the brachial artery, which is medial to the patient's. And you want to make sure the cuff is secure around, not too loose, and you don't want it too tight as well. You should be able to have a little bit of space. So you can place the dial of the sphygmomanometer in here. And then you want to place your stethoscope on. You can place it over the antecubital area, over the brachial artery. And before you pump, you want to make sure that the knob is turned all the way to the right. So the dial measures millimeters of mercury in pressure, and each line is an increment of 2 millimeters of mercury. And once you place the stethoscope on and pump the blood pressure cuff, you're going to listen for 2 sounds. The first one is going to be the first Korokov sound, which is the systolic pressure, and the last one you hear, as you're going to hear the pulsing fade away, is going to be the diastolic pressure. So now I'm placing the stethoscope over the brachial artery, and you want to pump to approximately 160 millimeters of mercury. Then you can turn the knob to the left to release some of the air, and you want to release it about 2 to 5 millimeters of mercury per second. Okay, so the reading I got was 122/78. So once the blood pressure is taken, you should repeat the process multiple times, at least once more, with 1 minute apart to ensure accuracy.